Hello, these exercises have been designed for you to serve as an adjunct to your physical therapy program. Once instructed and cleared by your therapist, you may begin these exercises. Your therapist will instruct you on how many sets and repetitions you are to perform, as well as any special precautions you are to adhere to. If you have any difficulty understanding or completing these exercises, stop and consult with your therapist.
Hola, estos ejercicios han sido diseñados para usar como complemento a su programa de fisioterapia. Su terapista le indicará cuándo puede empezar los ejercicios, igual a enseñarle cómo hacerlos, cuántas repeticiones hacer y también cualquier precaución que usted debe saber. Si usted tiene cualquier problema con hacer los ejercicios, pare de hacerlos y consulte con su terapista.
Magandang araw po. Ang mga sumusunod na ehersisyo ay dinisenyo sa inyo bilang kaakibat ng inyong physical therapy program. Matapos kayong maturuan at mapayagan ng inyong terapista, maaari ninyong simulan ang mga ehersisyong ito. Ang inyong terapista ang magtuturo sa inyo kung ilang beses niyo gagawin ang bawat ehersisyo at ang iba pang espesyal na kondisyones o babala na kailangan niyong sundin. Kung nahihirapan kayong intindihin o gawin ang mga ehersisyong ito, huminto at magtanong sa inyong terapista.
Active range of motion and strengthening. This is when the patient is able to perform the exercises without assistance. Ankle pumps. To begin, place a small towel roll underneath the patient's leg just above their ankle and instruct them to move their foot up and down in a pumping motion. They can do both legs together at the same time, or in an alternating fashion. They should try to move fairly rapidly in order to get the blood pumping and help prevent blood clots. This exercise also helps strengthen the ankle. Active assisted range of motion. This is when the patient has some strength but needs assistance to complete the full range of motion. The key here is to provide the patient with the least amount of help that he or she needs. You will be assisting the patient with these exercises, so you want to pay close attention to your body mechanics. Try to keep your feet apart, knees a bit bent, back straight, and adjust the table or bed height as able in order to prevent excessive bending or stooping. This is all to prevent self-injury. Straight leg raise. To begin, assist patient in bending their opposite leg. Assist them in keeping their legs straight with toes pointed up. And begin to assist them in lifting their leg up and down, slow and controlled. Have them attempt to hold for 1 to 2 seconds and lower slowly, and avoid lifting their leg higher than their opposite knee. Encourage them to keep their thigh muscle tight to emphasize keeping their knee straight. This exercise helps to strengthen the hip and the knee, as well as maintain mobility at the hip and the knee. And can also work the abdominal muscles as well if you're encouraging the patient to try to keep their abdominal muscles tight as they're slowly lifting and lowering their leg. Keeping their opposite knee bent helps take some pressure and strain off the lower back. Make sure you move your body with the patient, slow and controlled. Passive range of motion. This is when the patient is unable to move their extremities on their own. Pay close attention to your body mechanics as you will be doing all the work, providing all the assistance to the patient. Make sure you keep your feet apart, knees bent, keep your back straight, and adjust the table or bed height as able in order to avoid bending and stooping. This is all to prevent self-injury. If the patient is unable to verbally communicate, look for signs of distress, such as facial grimacing, or they may try and resist your movement. And if need be, you might have to back off a little bit and adjust the exercise accordingly. These exercises all help maintain mobility by preventing joint stiffness and contractures that can develop during periods of prolonged bed rest and immobility. Lower trunk rotation. Start by bending both of patient's knees. Keeping their feet together. Place one arm across their knees and the other hand and arm across their lower legs. Begin to gently rock their legs from side to side, moving your body with the patient, moving slowly and controlled. This exercise helps to maintain mobility at the trunk and the hip. And occasionally you might have to readjust during the exercise if their feet slip forward. Placing your hands a little bit lower down by their ankles can help stabilize a bit better if that happens.